Excellent. All right. Well, thank you all for joining us for this morning's Community Research Fellows Training Program. We are really excited to partner with the UAB Minority Health and Health Disparities Research Center in offering this workshop. The Gulf States Health Policy Center is a collaboration of 3 organizations. First, the University of Alabama at Birmingham has a portion of the center that's located within the School of Medicine in the Division of Preventive Medicine. Also, we have a partnership among the University of Southern Mississippi and the Bayou Clinic. And we are really excited about being able to offer the program, as this will be the second community of the Gulf States program that has been afforded this opportunity. I am joined by Bianca Hawk, who is with the UAB MHRC, and she is serving as the project director for the Community Research Fellows Training Program, and she is based in Birmingham. This morning, we are going to take you through a series of slides to give you some information about the program. And as Bianca mentioned, the webinar will be open to allow questions periodically as we go through, but you're also more than welcome to use the chat option that's on the right-hand side of your screen. All right, so with that, we will go ahead and get started. Today's agenda will take you through a number of these items: the project overview, background, the process for applying for the program, what your roles and responsibilities will be, and another opportunity for questions and answers. So let's talk about the project a little bit. The CRFT program is a program that has been implemented by a number of universities across the country with the aim of implementing and evaluating a specific type of research called community-based participatory research for community members. And in general, the program is designed to ensure that individuals representing populations that are typically not included in research, making sure that they have an opportunity to build their capacity for being engaged in research. And the CRFT program is one such opportunity for individuals to enhance their knowledge. Also, what we want to do is make sure that we are connecting a couple of research centers at UAB with the researchers, organizations within the local community, and community members serving Alabama to address health disparities. Specifically at UAB, the 2 centers that are involved in this project are the Minority Health and Health Disparities Research Center, as well as the Gulf States Health Policy Center. So what are some of the goals of this project? Like I mentioned before, we want to make sure that we're training community members to be good consumers of research. So how do we make sure that community members understand how to review research information and research that comes out, but also how do they learn to work with folks in academia in order to conduct research within their local communities? Also, we want to make sure that community members also understand how to use research in improving health outcomes in the communities that they serve or in the communities in which they're a part of. And we want to make sure that community members understand how to work effectively with researchers. So often we've heard that communities are the subject of research, but community members are not engaged in that research. And so this project is designed to help turn that around. So one of the aims of the project is to enhance community knowledge and understanding of research. So through this program, the plan is to engage between 30 and 40 community members, whom we'll call community fellows, to participate in a 16-week long program where they are engaging in public health research training And also we want to hopefully see those community research fellows move into areas where they are able to serve on institutional review boards as well as community advisory boards. And the reason why this is important is because institutional review boards and community advisory boards help set the research agenda. They also help to ensure that research that is conducted within the local communities are the research is appropriate, and that the methodology that the researchers are using by which to conduct that research is appropriate for the community that's being served. So we want to make sure that the research fellows come out of this program with the skills necessary in order to move into those roles if they so desire. Secondly, we want to evaluate this program for a number of reasons. You'll learn through the program the value of evaluation, but in terms of through your participation in the program, we want to make sure that we're evaluating this program, one, to make sure that it's meeting the goals that have been set forth. Two, we want to make sure that we're meeting the expectations of the fellows that participate in the program, and we want to make sure that the program is aligned with the programs that have been implemented across the country. So we want to make sure that we're staying true to the original program that was developed. So in order for us to do that, if you're a participant in the program, you'll notice that we will go through a series of evaluation opportunities with you. There will be some qualitative and quantitative evaluation, which you'll learn what those things are as you go through the program. There will be opportunities for you to be interviewed by program staff. Also, there will be opportunities for you to take pre and post tests and also complete a survey at the end of the program to just allow us to understand whether we've been able to meet those needs that we set forth at the beginning of the program. So why do we conduct this program? Why do we implement this program? Particularly here in Alabama, there are a number of health disparities that need to be addressed, and researchers can't address all of those needs by themselves. And so there is the situation where it's necessary for us to engage others into the research process. And in this program, we're engaging community members as researchers in order to engage in that process of eliminating health disparities in Alabama. So for those of you who aren't aware, the leading cause of death for folks in Alabama is stroke. 43% of African Americans are obese, 27%, almost 28% of Hispanics in Alabama are obese, and that doesn't even take into consideration individuals who are overweight in the state. So you can tell that we have a significant obesity issue in our state. Also, 40% of adults in Alabama have hypertension, and almost 14% have been diagnosed as having diabetes. In Alabama, we have one of the highest infant mortality rates, which was 8.61 per 1,000 live births, which is almost 6 times higher than the national average. So we have a lot of work that we can do there. Also, in 2014, you'll notice that almost 10% of residents did not have health insurance. And so these are just a few of the statistics that we could put forward to explain why it's necessary for us to engage as many partners as necessary in this effort to reduce and eliminate health disparities. And so we want to, through the Community Research Fellows Training Program, introduce you to more data that supports the need for these types of programs, but also give you data to arm you with information so that when you're ready to go out into your local communities and take on a health challenge, you are equipped with, the information on how severe that issue is within our particular state, how severe that issue might be in our county, or how significant or serious that issue might be at even a census tract level. And throughout the course of the 16 weeks, you'll learn how to drill down and gather data at those levels if it's available to equip you with the information that you need to talk to your local elected officials, talk to individuals within health systems, talk to others within different organizations that may be able to partner with you in addressing that issue within your community. So some of the challenges that impact community members that we hear all the time is that, often there is mistrust among community members for those institutions that are designed to serve those communities. So often we hear that, universities come into our communities and they conduct all of this research on our communities, but they don't engage us in the process. They don't ask us what our thoughts are. They don't bring that information back to us after they finish the research. So why should we be engaged in the process? We also hear, the same thing from the, on the medical side, that community members, feel like that the doctors are, treating them, but not really engaging them in a conversation about, the treatment options and what might work best considering a community member's situation. And same thing on the, with everything that's going on right now across our country, you all probably have a ton of examples that we could use as it relates to mistrust of the police in our local communities. So how do we turn the corner and address those issues of mistrust and lack of communication? Well, one of the best ways, one of the most evidence-based ways that's out there right now is a method called community-based participatory research. And CBPR, as it's affectionately known, is a very common way that particularly academic institutions are engaging communities to address issues that either the researchers are think they're interested in, or if it's data-driven, if the data shows that there's an issue that's of particular concern to a local community, then folks in academia can engage communities using a very specific approach that has been shown to work in a myriad of communities across the country in order to address those issues through the research process. Also, it recognizes that in order to change those attitudes, there has to be a change in how we address the issue, how we balance power between researchers and people in the community who I call subject matter experts. And also, we have to make sure that we are very intentional about changing how we engage our community partners and not doing it at the last minute or as an afterthought, but engaging community partners at the very beginning of the research process. And so that's why you see at the bottom the asterisk there in green where it says research conducted with communities and not on communities. And so through the CRFT program, this is designed to develop community partners as well as academic partners to be able to jointly develop that research project, answer that research question, collect that data that's needed for research with the input of the community and not as an afterthought. So the community-based participatory research training is, like I mentioned, that missing link often. And so it is designed to make sure that we are improving how we go about our health promotion activities, how we go about our health policy change activities, any type of disease prevention initiatives, and ultimately research studies. And again, we just want to make sure that our community partners feel like they are equal partners in the research process. So some of the principles of community-based participatory research are, the ones that are listed here on the slide. We're building on the strengths and resources within the community. We're recognizing that community partners are subject matter experts. They live in the community, they work in the community, they raise their families in the community, and so they are the ones who are most knowledgeable about the things that happen within their local community. And so why is it that we are often going to those community partners towards the end of the process or as an afterthought. It shouldn't be that way. And so one of the other principles is that there's this collaborative and equitable partnership, and not just at the beginning or at the end, like I mentioned, but all throughout the process. There's co-learning and capacity building. CBPR recognizes that folks in academia are not the most knowledgeable about a particular topic. They may better understand the data and how the data was collected and how to manipulate the data, but that doesn't necessarily mean that they are as knowledgeable about a particular community that they're serving. And so through the community-based participatory research process, there is that opportunity for information to be shared back and forth, and an opportunity to build the capacity of both the community members and the academic partners. We want to make sure that all partners feel that they are benefiting from the partnership, and so often you will hear that all of the projects of the Gulf State Health Policy Center funds, as well as many of the other projects across UAB, there is a desire to have that shared interest and for the projects to benefit all of the partners involved. And so there is the sharing, the equal sharing of resources, whether that's human resources or financial resources. Everyone should be able to benefit equally from the partnership. We also emphasize that the issues that we are going to address through this program are relevant to the local community, and with community members having their eyes and ears to the ground, they are the ones who are usually better able to assess what the issues are that are impacting them in their county, in their city, at the census tract, on their blocks, that kind of thing. Community-based participatory research also expects that information is going to be shared with all of the partners, and that information is going to be shared throughout the process. Not, once a manuscript has been written and accepted and it's been published in a journal, but we want to also make sure that community partners are engaged in that process of writing. They're engaged in the process of looking at the data that has been collected and identifying trends or concerns that may warrant further study. And then also, like I mentioned earlier on in the presentation, that we want our CRFT fellows to, at some point, being available and prepared, equipped to participate in institutional review boards and community advisory boards. We see your participation as a long-term process and commitment, which is one of the principles of CBPR. It's not one of those programs where you're going to join us for 16 weeks and you're going to get all this training, and you might have one project that you're engaged in, you get a certificate that you get to hang on your wall in your office, and you're done with it. This is designed to really just jumpstart your career or continued interest or deeper interest and involvement in addressing community research that's needed within your local communities. So at this time, I'm going to stop here, and I'm going to ask if anyone has any questions that they'd like to ask at this point. And I'm going to open up the line so that everyone can speak if they like. Are there any questions from anyone at this point? All right, well, if not, I will mute the lines again, and then I will allow Bianca to take over from here. Bianca?
Yes, thank you, Ebony. So this portion of the webinar, we're going to actually talk about the details of the program, so some of the requirements, the deadlines, the application process, and some of the benefits of being in the Community Research Fellows training. Okay. Okay, so here is the application process. Many of you have already received applications, but if you have not, you can email me at bhawk, H-A-W-K, B as in boy, bhawk, at uabmc.edu to receive an electronic version of the application. We will also have the applications posted on our website, which is www.uab.edu/mhrc, which is where you came for the webinar. So you can either get an electronic version or you can download a hard copy of the application packet, and you can either email it back to me, scan it and email it back to me, or you can mail it to the address that we'll show you at the end of this give you at the end of this webinar. The completed application packet includes the application form, 1 resume, and 2 reference letters. The reference letters, 1 is professional, 1 is personal. And the packet must be complete in order for us to review it. We will not review any packets that are not complete. The resume, if you have not, we have some students who are interested in doing the CRFT program. So if you have not written a professional resume, we do have a resume template that I send with each application packet, and we have a reference letter form or template that you can give to your recommender so that everything is uniform when we receive your application packet. The deadline is a hard deadline of November 4th by 11:59 p.m. So you have until 11:59 on November 4th to get your application in, and that's via email or mail. The complete packet must be in. We are a little bit lenient on the reference letter because we know those letters will be coming from individuals, and that's something out of your control. But your resume and the application itself should be in by November 4th at 11:59. Those applications will be reviewed by a community advisory board. We'll have a meeting date where we'll review all of the applications that are complete. And you will have your letter of acceptance by November 18th. Once you get that letter of acceptance, we will give you a date to either confirm your attendance in the program or let us know that you're not going to be able to be a part of the program because we anticipate having a wait list. So if you could respond to that letter by the deadline in that letter so that we can make sure that we have enough space, the food, and we let people who are on that waiting list be able to be a part of the program if you're unable. Here we see the actual curriculum. So the curriculum is 16 weeks, and we say 16 weeks because before session 1, which is evidence-based public health, the actual session 1 will be an orientation. So that's the week prior, and we will see dates coming up here shortly. But the first session is an orientation, and that orientation is really important so that we can fill out paperwork and do our pretest. The pretest takes about 20 or so minutes. It's where we give you your binders, we give you all the information you need for the CRFT program. We go over the curriculum, we go over the classroom etiquette, all of the responsibilities that you'll have while you're in the program, and it is imperative that you're there on the orientation night because, like I said, the baseline evaluation that we will be doing takes about 20 to 30 minutes for you to do. It's baseline knowledge, and we need that before you actually start the program. This will be an opportunity for you to meet some of your classmates, an opportunity to meet us face-to-face regarding your points of contact, which we'll talk about at the end of this webinar, but it is imperative that when we have that orientation, you're there at the orientation. So it's 16 weeks with the orientation being first week, and if you notice, on session 16, it's an optional intensive grant writing, which is after your graduation. Your graduation is the week after your grant writing class, but then the following Saturday will be an intensive grant writing session that you could be a part of so that we can work on grant writing skills, grant writing for funding, and it's an intensive session that builds on everything that you've learned throughout this semester. As mentioned before, we have several evaluations that will take place during the semester. We have the baseline assessment, which I talked about, which we will do at the orientation. We have a mid-training evaluation that is during session 6. It's a shorter assessment, and it's about the actual program and not necessarily the content. What we want to do with that training evaluation is get feedback on how the program is going, because we don't want to continue in the same way if it's not working for everyone. So during session 6, you'll get a mid-training evaluation where you give us feedback, and if we need to make any adjustments for the remainder of the program, we'll have time to implement those changes to make the program a lot more effective and efficient. We also have follow-up assessment and evaluation, and that's just like the orientation evaluation. So at your graduation is where you'll get that follow-up assessment and evaluation, and that's your knowledge base for us to see how much knowledge was retained and if we're actually putting forth the information in a way that is being uptaken in a positive manner. So that evaluation is important on the last day, which is your graduation day. Each session that you have, you'll have a pre-test, a post-test, and an evaluation. And that's for the content of that day's session. So you have the pre-test knowledge test, your post-test at the end of your class, and then the evaluation will be on the actual topic and the speaker. Pre-test, post-test is content, evaluation is for the speaker and the actual topic. At the end of the fellowship, you will have an opportunity to participate in qualitative interviews where we get more input on how the program was, the content of the program, and you'll kind of get some of those questions during the evaluation, the mid-training evaluation and the end evaluation as well will be some of those questions that you'll see on that qualitative interview if you choose to do the qualitative interviews. These are roles and responsibilities. It is a requirement that you make a 3-hour once a week for 16-week commitment. One of the things that we are discouraging is not being able to finish the semester. It's okay to miss 1 or 2 or 3 of the sessions, but we don't want to make it a habit each week because each week builds off of each other. So if you miss too many of them, you're going to miss integral parts of the information that you'll need throughout the semester. There'll be homework assignments that will build off of each other. There'll be canvassing that you'll have to do, but parts of those information that you'll need for the homework are woven into each one of the lessons each week. So please really look at your schedules. It's on Tuesdays from 6 to 9 at the Western Health Center in Midfield, and I'll give you that information on one of the forthcoming slides. But it's a 3-hour, 6 to 9. Dinner will usually start. We do provide food. Dinner is usually starting. We'll set out the food at about 5:45, and we will try to wrap up the food around 6:30 so that you have your full time to get the information, apply the information, and ask your questions. We want you to have an interest in improving minority health, public health, or reducing health disparities on a large scale as well as in your local communities. We want you to understand the potential benefits and risks of research. We want you to be informed consumers of the research that you want to engage in. And we want you to definitely participate in all of the evaluations, your pre-test, your post-test, your baseline, your follow-ups, your midpoint evaluations. We need that information to make the program better. We need that information to make sure we're giving you adequate information that will actually equip you to do the work that you're trying to do in the future. Here are your important dates. Orientation, the first session, will be January 10th, 2017. Your official Session 1 Evidence of Public Health class will be on January 17th. Classes will go based on the UAB calendar. So we have breaks set up, spring breaks that will be in there. If there are any holidays, they are in your calendar as well. Once you actually get that binder at orientation, you will see that there are breaks within those 16 weeks. Classes end on May 9th, and as I said, that following week you'll have your graduation ceremony. May 9th is the last session class. May 16th is your ceremony where we'll actually give you the certificates, we'll have your banquet, but we'll also need you to fill out that post-evaluation. And that's on May 16th. And as we mentioned, after that we'll have a Saturday intensive where you can do some grant writing. Here is the location. It's the Western Health Center, 631 Bessemer Superhighway in Midfield. And it's on Tuesdays, once again, from 6 to 9. The logistics of the time, we're going to have dinner out for you and available by 5:45. And we're hoping to wrap up the food, the eating, and begin actual class time by 6:30. You'll have about two 15-minute breaks worked into your schedule. So you'll have about an hour and 15 of lecture, your break after lunch, after your dinner, and then you'll have time to actually apply the knowledge. So you'll have some group-based work, some group discussions, homework time, example time, and so it's not a full 3-hour lecture. It's broken up for time for you to eat, time for you to learn, and time for you to apply. So here are some of our frequently asked questions. As we mentioned before, how do you apply? You have a packet that consists of the application, a resume, and 2 reference letters. Reference letter from a professional and reference letter from someone that knows you on a personal level. Your resume, if you do not have a resume, we have a resume template for you, and a completed application packet, which means all questions answered. Each application packet will be reviewed, and we will let you know in a timely manner by November 18th whether or not you've been admitted to the program. Please respond to us by that deadline given in that letter so that we will have accurate numbers going into the program. And just to reiterate, incomplete application packages will not be reviewed. Is there a cost? CRFT is free for all participants. We actually provide you an incentive of dinner. We know that this is a long 3-hour course that you're giving your commitment to, and while we're not stipending you or asking you to pay for this class, we are, however, providing you that meal, so that's one less thing that you have to worry about on that Tuesday afternoon. We do want to let you know the approximate cost of if you were to take a class similar to this on a university campus. It's about $2,800 if you were to take a class similar to this. So this is the cost that we are eating per person once we give this free training to our community members or researchers that are interested. Are there job opportunities? We are not explicitly giving you job opportunities, but this does not mean that going through this program doesn't make you more marketable for research opportunity type jobs. So directly, no, CRFT does not offer those job opportunities, but it does give you the marketability of that knowledge base being on your resume. Will CRFT certify me as a public health researcher? You will receive a certificate of completion, and we will share your information with organizations that are looking for community members to serve on IRB boards, community advisory boards, or partner for funding opportunities, but it does not certify you as a public health researcher. And as I mentioned before, there is no stipend for the CRFT program, but we do provide meals each week. We will have your printouts. There's nothing that you will need to print. We'll provide you with jump drives, the binders, your bags, your pens, everything that you need to be a successful participant. We'll give you those things for your commitment to the 16-week course. And this is just to let you know that while you will hear mostly from Ebony and myself regarding this project, there are other people who are working with us to make this project a success. We have Maria Pizu here at UAB, who's a PI on the Gulf States Health Policy Center. We have Dr. Fuad, who is the MHRC director. Gulf States and the MHRC have partnered to bring this program to Birmingham. And we have Janice Thompson, who is the MHRC program director for community outreach. How our team is broken down, all of the participants will mostly communicate with me. So if there's any communication needed about classes, about signing up or registering for the program, about applications, about getting resumes, I'm your point of contact. Ebony Edmondson is the contact for our faculty for our speakers, for the logistical side of this program. And so you can come to either one of us, but we just want to make you aware that if there are participation specific questions that you may have, you can direct them to me. And I also want to mention, I noticed that it's not on here. I do want to give you the address, and I will send this out in an email as well and update our website with it. If you would like to mail your application in, our address is 301 20th Street North, and that's Birmingham, Alabama 35203. And you can direct that mail to me, Bianca Hawk. And I want to reiterate once again, the deadline is November 4th, 11:59 p.m. on that day. At least have your application in and your resume in. We are lenient on the referrals and the recommendation letters. These are some of the references that we use in our PowerPoint. And at this time, Ebony, if you can unmute the lines, and if there are any questions, we're able to take questions now. And I want to make mention of one other thing. We may have participants that have children. We are not at this time able to give babysitting or child care services during those sessions.
I've unmuted everyone's line, but I noticed that some people, it looks like, have muted themselves. So if you have a question, just make sure that you unmute your line before you ask your question.
I have a question.
And you are?
I'm sorry. This is John Paul Taylor.
Hi, John. Thanks for joining us.
Hello. Thank you. Thank you for doing this. So my question concerning the reference letters, the one personal and the one professional. The professional letter comes directly from another organization or entity that we've done work with before?
It can, yes. So
okay.
If you are, for example, let's say you don't work for a health, an organization that's related to health or health improvement, that's okay. The professional letter should come, if it doesn't come from your employer that's kind of in that realm, then it can come from any organization that you've worked with before in a professional capacity. It could be that you've volunteered and done something very specific to assist that organization. It doesn't have to be health related, or it could be health related. It's totally, up to you. But yes, one should be, someone who can speak to who you are individually, your personality, character, character traits, that kind of thing. And then the other reference should come from someone that you've done some work with or volunteered with in more of a professional capacity.
Thank you.
Great question. Thank you.
And I have received.
Go ahead,
I have received a question via email, and one of the questions were, are the sessions recorded? At this time, the sessions are not recorded. So what will happen, and we don't encourage this, but this is something to help out our participants. If you miss a session, what will happen is after you miss the session, we'll get the PowerPoint for you. We'll give you all of that information. But before we give it to you, we still want you to do the pre-test. So we will send you, once you let us know that you're not in class, that you won't be able to do class that day, we'll send you the pre-test, fill out the pre-test, send that to us, and then we will send you the slides that the faculty member has presented in class after the class. So if the class is on Tuesday and you let us know on Monday that you won't be able to make it, we'll make note in our record, and then on Wednesday you'll receive a pre-test from us. Once we get that pre-test back, we'll then send you the slides. And then after you get the slides and you let us know that that you received them, we'll send you the post-test after. But you won't get that information until after class. So you won't get that pre-test or slides until the Wednesday after.
One other thing to keep in mind is as you're preparing your application, please take the time to send in a professionally crafted resume. I know it's very convenient to print maybe a LinkedIn account that has all of your the organizations or employers that you've had in the past, but really do take the time to create your resume in Microsoft Word or some other word processing platform and send that in to us. It makes it easier for our reviewers, our evaluators to judge your application. So we want to make sure that we're giving them everything that they need in order to do that successfully. Are there any other questions?
Yes, I have one more question about and when they send it in, I saw, is there a way for them to electronically mail the reference letters, or they must be mailed in?
They can email them to me. They can email them to me. Mm-hmm.
Okay.
One of the things I don't think we covered during the presentation that I think is helpful to note is that just like we mentioned all of the benefits of community-based participatory research, as we're going through the 16-week sessions of the CRFT program, we've been mindful to engage community partners as faculty members as well. So you'll notice when you get your materials that there will be individuals from academia as well as individuals from the community who have expertise in a particular area who will be delivering the sessions to you. So we've been very fortunate to be able to partner with the health staff from the health department, staff from other universities, staff from community-based organizations to deliver information so that you have that balance there. So we want you to make sure that you don't feel that you have to, change how you would ask a question or your approach to any of the faculty members just by virtue of where they work. So we wanted to make sure that we incorporated, that thoughtfulness into the selection of the faculty members and have a balanced approach to the training that you receive. So I wanted to make sure we do that out there. I also see a question in our chat box that says, would these sessions apply somehow to obtaining a Master of Public Health degree? Thanks, Janet, for that question. The sessions are intensive, and you will, for some sessions, receive about 2.5 hours worth of training. For some other lectures, you may have a lesser amount of time to cover a particular topic, just because we can't cover all of the information in 3 hours, and we want to make sure that we keep the program to a point that individuals will stay throughout the entire length of the program. So the topics are really going to give you a high-level overview of whatever the session title is. So a 3-hour session on quantitative methods or qualitative methods is not nearly what you would expect to receive if you were in a Master of Public Health program. However, if you're interested in pursuing a Master's in Public Health, then this 16-week program will really give you a good introduction to the types of sessions the types of classes that you would have to take if you were to pursue an MPH or an MSPH. So I hope that's helpful. But definitely know if if you're interested, if you think you're interested in pursuing an MPH or MSPH, probably going through this program will give you a better sense of whether that's the direction that you'd like to take or not. Are there any other questions? Well, if not, we are really excited about your interest in the Community Research Fellows Training Program. It is something that we're really excited about offering. One of our other Gulf States partners, the University of Southern Mississippi, implemented one earlier this year, and it was extremely beneficial to the community partners. In fact, one team has subsequently received funding, small pot of money, to implement a project that they conceptualized while they were going through the CRFT program. And then one other participant on their own submitted an application to a community foundation, and they were awarded funding based on a project that they conceptualized during the CRFT program in Hattiesburg. And so one of the frequently asked questions was about job opportunities. And while this program does not specifically, develop you to move into a particular role or any jobs that we might have available through the Gulf States Health Policy Center or the Minority Health and Health Disparities Research Center at UAB. Some of the experience of other CRFT members, CRFT participants, particularly in Jackson, Mississippi, has been that they have been able to use that experience and that knowledge gained through the program to prepare them for job opportunities that became available. And so a number of the CRFT graduates in Mississippi found themselves able to pursue and secure job opportunities at the State Health Department here. So this is definitely something that will, just here in Birmingham as well, expand your knowledge base and maybe make you a little bit more competitive for some positions that may open up in a number of different organizations. All right, well, if there are no other questions, we wanted to make sure that you had the contact information for both me and Bianca. Please make sure that you direct all of your application materials to Ms. Hawk. Her information is at the top of your screen there. Also, like she mentioned earlier, if you have any references that are going to be submitted on your behalf, please, you can have those emailed to her as well. Bianca, did you have any parting thoughts?
As I just saw in the chat how we're seeing a lot of the excitement. We're actually excited to implement this in Birmingham, and we can't wait to start with our first cohort in January. So if there are other people that you know of that maybe didn't receive the email or need a flyer or need more information or just want to ask questions, please tell them to give us a call. We actually recorded this webinar and we'll post it on our website. So if anyone needs to go back in case they missed anything, the webinar will be available for viewing on our MHRC website as well as our community outreach website on the UAB website. So please just spread the word and let people know about this opportunity that's coming to Birmingham, because we hope to have a full class so that we can increase the number of people that are informed consumers of the research that we're all a part of and we all want to be a part of. So just please spread that word. We're excited to meet each and every one of you. We're looking forward to receiving your applications. And if there's any questions, please don't hesitate to let us know or ask us. We're almost available 24/7, especially by email. So just don't hesitate to call us or contact us with anything.
Wonderful. Thank you so much. You all have a wonderful day.